So, ladies and gentlemen, my name is Sharon Whiteman, and I'm on the board of the Lyme Disease Association of Australia, and it's my great pleasure and privilege to have Professor Christian Perronne tonight. We're recording this on the 23rd of December, just before Christmas, and part of our intention of the board of the LDA is to offer our Lyme disease patient community in Australia and New Zealand some hope, and to recognize that even in times of where it seems hopeless, which so many people have been expressing to us, that there's people, and you know, I'd also like to say that our Australian doctors are effectively silenced, either through being deregistered or restricted in their practice. But the world's watching and the world's standing up for us. And Professor Perronne is one of those. So I think in times of trauma, it's really important to be seen and to be heard and to be believed. And these doctors in this short series of A Global View on Lyme disease is going to demonstrate that to you. So you may not have had the pleasure or the privilege to know anything about Professor Perronne. He's a MD, PhD qualified in internal medicine. He's a professor of infectious and tropical diseases at the University of Versailles in Saint-Quentin, France. Since 1994, he's the chief of the Department of Medicine at Raymond Poincaré University and Hospital in Greater Paris University Hospitals Group. He had major responsibilities with several institutions, including Pasteur Institute in Paris. He's the vice director of National Tuberculosis Reference Center. French College of Professors of Infectious and Tropical Diseases, he's the chair. French National Technical Advisory Group of Experts on Immunization, he's the chairman. French Drug Agency, chairman of several working groups making evidence-based recommendations. Superior Council for Public Hygiene of France, the chairman. French High Council for Public Health, chairman of Communicable Diseases Commission. National Council of Universities, chairman for Infectious and Tropical Diseases. European Advisory Group of Experts on Immunization at the World Health Organization, vice chairman. He was principal investigator of several major clinical trials. He's the author or co-author of more than 300 scientific publications in peer-reviewed journals. Since 1994, Christian is involved in the management of chronic Lyme and associated diseases. He is leading a coalition of patients and physicians for the recognition of chronic Lyme disease and other crypto or stealth infections. He is the co-founder and vice president of the French Federation Against Tick-Borne Diseases and president of its scientific council. He is author of a book, which I won't say in French, The Truth About Lyme Disease. Professor Perronne, thank you so much for being here tonight.
Thank you, Sharon. Good evening. It's the morning here, but it's the evening in Australia. So I'm very glad to be with you today.
So can you tell us a little bit about how you ended up being involved in championing Lyme disease patients from the beginning?
I was very young at that time. I was a young resident, and my young senior registrar came back from the US, from the CDC in Atlanta. He was there for another topic, Legionella, but he discovered at that time that they were speaking in the US about a new disease. It's not so new, we know now, but it was called new at that time. And he came back in his pockets with kits to realize culture of Borrelia burgdorferi and also serology. And he was the first guy in France to consider this disease and to do something to diagnose patients. So I've learned a lot with him, and he was he got a position of professor of infectious disease in the hospital where I work now, and years later, unfortunately he died young, and I was nominated professor in this hospital 2 years after his death. And he created in France the first national reference center on Lyme disease. It was in my hospital, but as he was dead, the reference center was moved before I arrived 2 years later to the Pasteur Institute in Paris. But in the Pasteur Institute, they didn't really believe in Lyme disease. They were not very well motivated, and they didn't do anything. So after that, the center was moved in Strasbourg, in the eastern part of France. And there the experts are very strongly anti-Lyme minded, and it was a big problem in France. But I always continue to take care of the patients.
And you found, we were having a chat earlier, you found that patients, even though the medical advice at the time was that 3 weeks was enough, you consistently were noticing some patients relapsed after that and needed longer.
Yes, because when I started to take care of Lyme patients, it was in 1994 and later. At that time, the controversy was not so difficult because it was published in the major medical journals, the New England Journal of Medicine, the Lancet, but you have patients with positive culture of Borrelia burgdorferi from the blood or other tissues with negative serology. It was not a real controversy at that time. I don't know what it became afterwards. So it was something what was acknowledged in the medical literature. And in my personal experience, because at that time the recommendation was to treat for persistent cases to give 3 weeks of antibiotics. Many people were improved after 3 weeks, but the problem is that when I stopped the treatment, they relapsed afterwards. So I didn't understand why at that time. And I could treat them once, twice, and more, and always they experienced a relapse. So I saw that there was a big problem. And when I discussed with my colleagues, they didn't believe in the disease. They thought that the test was perfect and that a 3-week course of treatment would cure everybody. But we know that all this is a big lie.
Mm. And so you've gone on now to persist, and actually that situation has changed. There's quite a lot of controversy in France now, isn't there?
The controversy in France is still ongoing. It was much better a few years ago because at that time the Minister of Health, she changed afterwards, was convinced that there was a huge medical problem, that many French patients, thousands of them were in medical wandering. They couldn't find any solution. They suffered a lot, but they were completely rejected by the medical system. And at that time, the minister said that publicly in the media, and she launched a big French national plan for Lyme disease and other tick-borne associated diseases. So we worked together with anti-Lyme and the pro-Lyme people, and we could write together a text that was not perfect, but was a rather good text compared to what existed before. But unfortunately, during the last meeting with the other people who didn't agree completely, they said, okay, we'll sign the text, we agree. And 2 days later, they sent an email to the whole France saying, this text is a scandal, we won't sign it. I don't know what happened in 2 days, but I think they had huge pressures from different lobbies to say, no, you should never sign this. And unfortunately, these people who were in the group could influence all the French learned societies. And in the learned societies, only a few people spoke with them, not the whole society. There was no democratic interview of all the members of this society. Just a small group said, okay, no, we don't believe in chronic Lyme. And it's a pity because when we were in the group, we could rely on scientific evidence, because the fact that the serologic texts are not perfect, it's completely proven in the medical literature. There is no a single text proving that the serology is reliable, 100% reliable, as it continues to, many people continue to say. It's completely fake information. Because if you look only at Borrelia burgdorferi, there is a very good meta-analysis published by Cook and Perronne in 2016, showing that only for Borrelia burgdorferi sensu stricto, less than 60%, there is less than 60% sensitivity of the test. And that's only for one species, but we know that there are several species for the group Borrelia burgdorferi and Sulato. And for the other species, there is not a single test. We know now that you have 10 or 20 species of Borrelia who can give exactly the same disease, but that's not included in the serology kits. So you can never diagnose all these people. And for the persistence of Borrelia after 2 weeks or 3 weeks or even 1 month of treatment, it's not fully demonstrated in the medical literature that Borrelia may persist, because the Borrelia, when it is attacked by antibiotics and sometimes also by the immune system, they switch from the spirochetal form, the mobile form, to a round immobile form. They hide in the tissues, in biofilms, and they escape the antibiotic. It's not a true resistance because they remain susceptible if they're sensitive, if they grow again afterwards. The antibiotics is still working, so it's an escape. So you have studies in vitro, many of them. You have studies in the animals, especially Monica Ambers in the US did a really fantastic job in monkeys, in macaques, showing that Borrelia was persisting after several months of antibiotics. And you have, I think, 20 medical publications in very good journals showing that you can recover Borrelia in culture or by PCR. PCR is the amplification of the DNA of the bacteria, of the bacterium, even after several weeks or months of treatments. All that is proven. Why the international medical community does not read the medical evidence? They should change their classes, I think.
So again, the denial of chronic or persistent Lyme disease is also non-scientific.
No, the denial is not scientific at all, because we have all the proofs in the medical literature. But you have misinformation, which is led by the Infectious Disease Society of America. And we know that people in the IDSA and the others, the same in the CDC in Atlanta, are corrupted people. I say that publicly because I signed this with Jenna Rouchet-Thayer. She was an American woman who a governmental organization in Africa, in Asia, and everywhere. She was ill herself, and we went to Geneva at the United Nations to see the two special rapporteurs, and we co-signed public reports about that, where we said that there was in the US a legal corruption authorized by the law because all these people have the patents on the very bad serologies that are marketed everywhere in the world. They win a lot of money, and they are able to block any new test that could be much better. How are they authorized to win a lot of money on bad tests and to block a new good test? That's not ethical, but it's authorized in the US. That's a major problem.
And so you think that challenge in the US is reflected in Europe and obviously here in Australia as well?
I think that there's a small group of experts in the US who said for decades that Lyme disease is a rare disease, very easy to diagnose, very easy to treat. They organized a system. I don't know in detail how they did that, but they control all the medical societies in the world. They control all the national reference centers in every country. And all they copy the same sentences without any scientific reference, and they influence all the governments. So that's a huge medical scandal worldwide.
And I know a few days ago when we had the same kind of chat with Dr. Horowitz, he was saying that there is no other disease that has an experience like that's so politicized like Lyme disease.
Of course, there's not a single other disease with this the same denial. You don't put it, because in France, a biologist was sentenced to jail and 200,000 euros penalty. She was fired from the board of biologists. Her lab was closed because she did Western blot that was more sensitive than the official Western blot. Do you imagine another disease, syphilis, tuberculosis, I don't know what, where people are condemned at such major penalties just for trying to do a more sensitive test? And when you see all these physicians everywhere in the world fired by the board of physicians because their only crime is to treat patients who are suffering, and they cure some of them and they improve their medical condition, why all these physicians are attacked? It's a great scandal. And fortunately in the US, because I think that the US government is realizing that they were in very bad condition. There are millions of patients with Lyme disease now in America. The attack against physicians has nearly stopped. I know one or two cases sometimes, but now they are protected by laws. And the great news, if you follow the news, just a few days ago, there is a new law in the United States who will, I think, go on our side and protect more and more the physicians, and will give a lot of money to fund research. Because I think the big problem in Lyme during 30 years, there was not a single buck for the research. Now it's changing. And the good sign for me is that the pharmaceutical industry is coming back on the area. Before they were completely out. Probably people said them, no, don't go online, it's very easy to diagnose, to treat, there is no money to do. Now they are realizing that there are lots of people infected, millions and millions everywhere, but there are a lot of species of Borrelia that are not even diagnosed today, so they have to develop new diagnostic tests. We have a lot of co-infections with Rickettsia, Francisella, Coxiella, and Bartonella, Babesia, and so on. So, or maybe vaccines and so on. So I think now the industry is changing. That's a good sign for us, because the major fundings in the medical field come from the industry.
Yeah, and sadly in the United States, a senator had to die before that action to be really get across the line, isn't it?
Yes, it's a pity. And this senator died from a viral infection, Powassan virus. That shows that the tick-borne diseases are not only bacterial. You have Borrelia and all the other bugs I told you about, but also parasitic. Babesia, now we are finding in my own research Filaria, another parasitic bug, well known by the vets, but not by the medical community. And I think that in the cases of failure of treatment with antibiotics, antiparasitic drugs, some patients are infected with viruses. And we know now, it's not yet very well published, but some research works showing that some viruses may have a chronic course in humans, and may probably be involved in these old chronic courses of the disease.
And so,
multi-infection disease.
Professor Perronne, what do you think? What are your thoughts on the global prevalence?
Oh, it's difficult to give a number, because, as you know, all the numbers are based on the current serology, which is very bad, and only Borrelia burgdorferi sensu stricto, extended in some countries to 2 other species, Garinii and Afzelii, but and with a very low sensitivity cutoff. So I think all the numbers are highly underestimated. But now if you look at the official recognition, in the US they acknowledge for more than 2 million patients. I think it's much more. With some European researchers, we made an estimation in Europe. Unfortunately, it was not published because we were rejected in all the medical journals. Unfortunately, the journals are controlled by our opponents and they reject papers which are not in, which do not support their talks. We estimated it was really a strict minimum, more than 1 million new cases each year in Europe. So I think there are millions and millions, and even it's not the Borrelia burgdorferi, even sensu lato giving the Lyme disease. We know since the 1920s from Charles Nicolle, he was a French expert. He was director of the Pasteur Institute in Tunis, in Tunisia. And in the 20s, he published about relapsing fevers in Africa. And he said that many chronic inflammatory diseases, degenerative diseases were due to chronic infections. And he showed at that time that many high-grade fever cases in Africa were not due to malaria, but were a consequence of a Borrelia infection. It's still the case now because you have more recent studies confirming that from the French teams, American teams, African teams. But you have no diagnostic test developed for relapsing fever in Africa. Why? And if you have high-grade fever in Africa, they said, okay, it's malaria, okay. If the test is positive, no problem. But if the test of malaria is negative, they say, oh, it's a test negative malaria case. Okay, for malaria, it is accepted. But you are not allowed to say maybe it's a Borrelia case with negative test because there is no test. So that's a great scandal. Why? Because of we are not allowed to speak about Lyme disease due to an American policy. Why do we can't have access to diagnosis in Africa, Asia, everywhere in the world? And in Australia, I saw that your government say there is no Borrelia burgdorferi in ticks. I think it's a fake news because you have several publications which showed that Borrelia burgdorferi could be found in ticks. Many people were contaminated. I saw all the references about that. And even it's not, in some cases, Borrelia burgdorferi, it may be other species, Australian species. It may be other rickettsial species. We know that rickettsia may give a chronic infection. It's known for nearly 1 century. When you have the epidemics of typhus with rickettsia, it could be chronic in some cases. You can have Coxiella burnetii, Q fever, very frequent in Australia. Normally diagnosed with serology, but I have many cases now with positive PCR and negative serology. So we think now that serology is not very good for this disease also. So it's not important just to focus on Borrelia burgdorferi sensu stricto. There are many more bugs involved.
That's a very important point, isn't it? Especially, and are there other diseases that would set the precedent where, there's not a blood test for it, or whether there's scientific or medical uncertainty or a gap where patients are denied medical and health care like the cohort of Lyme patients are?
I don't know another disease like that where patients are rejected. But now that we're looking more at the accuracy of serologies, I realize now that serologies are very difficult to define the cutoffs, you know, because, for example, when I was a young physician, for me, brucellosis serology was perfect, but now it's published that you have many cases of seronegative brucellosis. The same thing I discovered from Q fever is the same thing for many. Why this? Because when, if you are a ELISA manufacturer, the machine is automatic, it's not the fault of the machine. You have to define the cutoffs on populations of patients and controls. If I take the example of HIV, it was very easy when Montagny and the others could culture the HIV virus, because you could take 100 patients, be sure that they were HIV infected by culture, and then you calibrate your machine to have more than 95% positive. And then with your machine, you go to blood donors, healthy blood donors, and you check that they're less than 5% false positive. So it's very easy to calibrate. Of course, it's never 100% in medicine, but if you cross with two different techniques, you can reach nearly 100% accuracy. In Lyme disease, it was impossible to do that. But why they don't recognize that? It is completely published by European CDC. You know, you have the American CDC in Atlanta. Now we have a ECDC in Stockholm. They published a very good report in 2016 saying, be very cautious about all these perfect serologies, which are heralded by national reference centers and manufacturers, because these serologies were not calibrated, were not defined on good populations. How you can select in the population 100 patients with Lyme disease, you are sure they have Lyme? It's impossible. Signs and symptoms are either there are symptoms only subjective, pain and fatigue, you cannot measure it, or if you have objective signs, all the patients have objective signs, cardiologic signs, the ECG is not going well, or you have pulses, or you have joint problems, arthritis, the MRI is not normal, and so on. But these anomalies are not specific of Lyme disease. You can see the same thing in other diseases. So you have not, it's impossible to make, for example, a clinical score that is possible in other diseases. Then you should rely on biology, but it's impossible to have a gold standard in biology, because culture is not often positive from the blood, at least. If you remember, Willy Burgdorfer said, if you want to search my bug in the blood, it's very difficult. It's better to take a piece of brain. He said that with a bit of, but I cannot take the brain of my patients. So the sensitivity of culture is poor. PCR, the amplification of DNA, is not so good at the present time. It may be good, but not sensitive enough. So it's impossible to define a population of ill patients. So if you look at the official recommendation, which were completely officially published by the IDSA, by the European group, what was called at that time EUCALB, European Union Concerted Action Against Lyme Borreliosis, they said the serology should be defined only on blood healthy blood donors. It's completely stupid to define the cutoffs on a healthy population, but that is a law, and they put the cutoff at 5%. It's not allowed to detect more than 5% Lyme people in blood donor community. It's completely stupid, because in some areas in the world, much more than 5% of the population has antibodies. I don't say that they are all ill, because you can have antibodies and be in good condition, but they have positive antibodies, but they are not allowed to be detected. So it's not a scientific approach.
Mm.
And one of my colleagues, who is a vet biologist, saw how serologies were accepted and recorded by the different countries and authorities. It's the same thing in France. I asked at the drug agency, which is in charge of the validation of the kits. They say, oh, we compare with the previous test that is officially recognized. But the previously officially recognized tests are not good. It's proven by meta-analysis. And my friend, he came back in history to see what was the first test recommended in the US, which served as a gold standard to compare all the further tests. And it was a test published by the CDC in Atlanta, saying we have done a very good test done by the reference lab with a reference technique, so it's perfect. And when experts wrote to the CDC to say, what was the reference lab, what was the reference technique, they never answered. Mm. And if you see the interview by Willy Burgdorfer in the Under Our Skin, he said they gave the results of the serologists before doing the research. Wow. Willy Burgdorfer himself said that because he knew that at that time. So that's a pity. These serologic tests have, for me, strictly no value.
So that's a big challenge then for treating patients, isn't it? Because that's what doctors are taught to: one test, one disease, one treatment. So your experience and what is best practice for this situation? You've got a patient presenting with symptoms and they've got negative serology. What's your advice for doctors?
So in France, the report was published in 2014. The High Council for Public Health has been asked by the Minister of Health at that time to make some recommendations and a report about Lyme disease. And the experts were not experts of Borrelia. They were not the National Reference Center because they wanted independent experts, not too much influenced by the Infectious Disease Society of America. And these people who were high-level researchers were amazed to see the low level of evidence of serology. They saw that it was not good. They saw that there were many Borrelia species of co-infections. And they wrote, I was not in the group because I was the chairman of the council, but I said I don't want to be inside because they would say that I would have influenced. So I'm happy not to have been inside at that time. But what they wrote, I was really glad. It was exactly what I was thinking. They said, either we wait 20 years to have good scientific results, or we abandon all these patients. So as we have no accurate test today, either for Borrelia or sometimes no test at all for the other species or other bacterial parasites, we should recommend at least a 1 month empiric antibiotic treatment. Empiric means it's just a test, it's used as a diagnostic test. We do that sometimes for tuberculosis, because all the cases of tuberculosis are not proven by culture of the bacillum. And it's recognized in the official medical by the medical authorities everywhere. It's accepted for tuberculosis, but not for other disease. Mm-hmm. And they said we should recommend that in France, that the GPs could treat if they have a strong feeling that it could be Lyme disease, the test is negative, they have searched for another disease that is not present. So they should try. And if there is a response, the response may be an improvement, or sometimes maybe at the beginning worsening because of the Yarish-Herxheimer reaction, then the physician could be authorized to continue the treatment longer. But the High Council for Public Health published a report on the internet in French but it was not really a very strong recommendation that could be followed by all the communities. So more recently, it was published last year in June 2018, the High Authority for Health, it's HAS in French, Haute Autorité de Santé. The group where I participated in this group, but also with anti-Lyme people with the National Reference Center. We said the same thing. So now in the official French recommendations, it's written that any GP can try a 1 month empiric antibiotic treatment to see if there is a response in his patient. Unfortunately, all the learned societies led by the National Reference Center was very upset by this text because it was the official recognition that their diagnostic serologic test was not good at all. So they couldn't accept that. So they organized a huge lobby to block these official recommendations. And if you see on the literature, the French Infectious Disease Society published recently so-called guidelines, the new French guidelines about Lyme disease. They are terrible. They are worse than the IDSA 2006 but they are not official at all. They are not recognized by the authorities. Unfortunately, the French official guidelines are only written in French, not in English. But so there is misinformation, and we see exactly the same thing in the US. If you see that last year in November 2018, the official working group, the tick-borne disease working group of the US Department of Health and Human Services, published a very good report. They say diagnostic texts are not very good. They say we ignored before many other species and co-infections. Treatments have never been correctly evaluated. There were no money for research and so on. Everything is written. Even for the so-called PTLDS, the post-treatment Lyme disease syndrome, it was a very bad syndrome invented by the IDSA to say all these patients who continue to have complaints after 2 or 3 weeks of antibiotics, it's in their head, in their mind, they are not really ill, it's a psychosomatic and so on. Now it's fully written, and among all the possible factors, including psychosomatic factors, but also environmental factors, you may have the persistence of microbes, bacteria, even parasites. That's a major point, that PTLDS is not anymore a post-infectious disease syndrome. It may be a persistent infection. So this official report from the American Ministry of Health was a major breakthrough. And it's completely amazing to see that the Infectious Disease Society of America, the IDSA, published recently the so-called New American Recommendations that are terrible. They are worse than their own so-called recommendations in 2006. It is written in a paragraph. You shouldn't look for Lyme disease in people with neurologic syndrome. You shouldn't look for Lyme disease in patients with joint problem. You shouldn't look for Lyme disease in patients with cardiac problem. You shouldn't look for Lyme disease in patients with psychiatric problems and so on. So there are horrible recommendations. If you look, there was a very important protest worldwide with more than 80 or 90 organizations who wrote
to contest those, yeah.
Point by point and based on scientific evidence.
So that's all pretty bad news, really. That looks like, but on another level, they're sort of backing themselves into the corner that it's so obviously biased and non-scientific.
Sorry, because it was a little bit cut.
Did I? Yeah, on one hand, it would seem very hopeless and very bad news. But for patients watching today, It's also they're backing themselves in the corner because it's so ridiculously non-scientific.
Yes, I think I'm at the same time optimistic and pessimistic, because when I look at the medical literature, at the results of recent publications coming from different countries, the scientific evidence is on my side, is on the side of the patients, on the side of the Lyme doctors. But where I'm a little bit pessimistic, I see that especially in Europe and also in Australia and in other countries, all the learned societies, the governments are more and more opponents to the Lyme disease cause. I see the same thing in France. The former minister was very open-minded and it was going forward and new recommendations. And now, for 2 years, it's terrible because the Academy of Medicine, all the medical societies made a huge lobby to the government to obtain that they nominated clinical reference centers where the physicians are strongly anti-Lyme. And I was candidate to be a reference center, but I was rejected because they said I was too close to the patients. You know, for a physician, it's a huge problem to take care of his patients. It's not normal now if you look at the way they are badly minded. So now in France, it's going back. I think it will go in the good way in the near future. Fortunately, I have the support of more and more patients, the support of the media. So the media support is important, I think.
And so getting back to the facts of being a denied, and very vilified disease, what is the impact? In Australia, our survey shows that it's on average 10 years to diagnosis. What's the impact of delayed treatment because of that denial? What do you see?
It may be very long, because I see patients, sometimes they have 3 decades of suffering, medical wandering. Some saw 80 physicians, 20 psychiatrists before finding a Lyme doctor who sometimes cure them in a few months. So that's terrible. It's the same thing everywhere. So it's not only I cannot do a mean duration of wandering, but it's very important. And some ministries in the world are afraid, saying if we follow the Lyme disease cause, it would be a huge medical cost for the community. That's completely stupid, because the wandering during 2 decades, it's a major cost for the society. The direct cost of the disease, but also all the indirect costs. You have the sick leaves to pay, you have all the hospitalization, thousands of non-useful examinations, MRIs, and so on. And with some Belgium university colleagues, we just wrote an article about that. It is submitted to a medical journal, so it's not yet published. But so it's stupid to be narrow-minded, to think that, because if you cure somebody who is ill for 20 years with 6 months of doxycycline, a little bit of hydroxychloroquine, they are generic drugs, they just cost a few bucks. It's not a good way of seeing things. But as you know, in the United States, in France, we have most of the medical insurance is public, with a complement with private companies. But in the US, it's mainly completely private. We know that the insurance companies for medicine gave a lot of money to the IDSA experts to say that Lyme disease doesn't exist. That was proven by judges. They were condemned. They escaped the tribunal because they were protected, but there's a new trial ongoing now. That's not normal. And I think all these insurance companies are not well advised because it could cost less to treat these patients.
Yep. Yeah, then to look after them through disability and lose their productive in society and their jobs and their careers and their communities. And so, why do you think, what is it that you'd like to say to, like in Australia, there's, as far as I know, there's only one infectious disease that's openly supportive of Lyme disease and has been for a long time. He's one of the doctors that you'd say has been in the trenches. And then there's a couple that I know sort of around 2 or 3 that are sort of not 100% against it, but it's such a terrible situation for doctors that they don't stand out. What do you say to infectious disease doctors that stay entrenched in the position of, like in Australia, it says there's no evidence of Lyme disease in Australia?
Because I think that when all these denials start in the United States, the experts from the IDSA control all the major editorial committees of the major medical journals, the New England Journal, the Lancet Journal. They could publish all what they wanted, even if it was not evidence-based. If you look at all the articles published in New England Journal about Lyme disease, the methodology is very poor. It's not usual for such a prestigious medical journal. So, but if a physician in Europe, in Australia, reads a paper in the New England Journal, for them it's a medical Bible. They say it's a truth, even if it's completely fake news. So I think these medical publications completely misleaded all these physicians. And because now young physicians rely only on publications. They want everything to be proven. So if you have not a serology, a test which says it's Lyme with certitude, they say, no, we cannot treat. Yeah, and that is a bad evolution of medicine now, because when I was younger, my former bosses were much more open-minded. At that time, many diseases were not completely proven and they had their personal experience. They could publish about it. If I publish that I cured many patients with this diagnosis or this diagnosis, now I'm not accepted in the journal. They say, what you say is impossible. Why they say it's impossible? I did it. The journals are under control. And the other point, I think that's we're attacked by the huge lobby, which is antibiotic. And it's funny because I was the first in France to alarm the minister at that time, it was a long time ago, about sometimes the excess of prescription of antibiotics for viral infection and so on. So I was very well concerned by that. But now the huge problem of antibiotic resistance is first the use in animals. Officially now in Europe it's not allowed anymore, but we know that it continues a lot to be used. And in humans, the major problem is in hospitals. People in intensive care units with cancer, with chemotherapy, very immunodepressed. And the big resistance problem is with hospital molecules, hospital antibiotics. If we give more doxycycline for amoxicillin, simple old antibiotics for people in the community, that's not a problem really for the antibiotic resistance issue in a country. But our opponents, they make the confusion, say, oh, look at all these Lyme doctors, they are foolish people, charlatans. They give antibiotics for tired people or people who had pain in the toes, and it's a great menace for the health security. That's completely fake information.
Yeah, more fake information. And so, getting a bit of feedback here, I hope it's okay. What do you think are the solutions, Professor Perronne?
The solution is to be open-minded, to fund research, but fund research is also not only to fund the current official labs, recognized by IDSA or National Reference Centers, because they will take the money to make bad research and to say we confirm that Lyme doesn't exist. So money should be given by a public call for projects, and the attribution, the dispatch of the funds should be under the control of association of patients, because what is terrible in Lyme, when I started in my career in medicine, it was the beginning of AIDS, the patients, the HIV positive patients, were present everywhere. They were present in the National Agency for AIDS Research. They were present in the Scientific Council, in the board of the agency. They were, when I was a young physician responsible for clinical trials, I had to discuss with the representatives of the patients. It is recognized in any disease, not in Lyme. So the first thing, to give a little bit of a representation to the patients, to say, no, we don't agree, you give all this money to a lab who is strongly against the disease. And also waiting for the results of research. We should authorize in all the countries to do what was recognized in France, but now a little bit counterattacked, to authorize any GP to give an empiric antibiotic treatment as a diagnostic test, and to allow a longer duration of treatments. Of course, I can hear now all the authorities saying he's saying stupid things. We cannot evaluate all this. We agreed in France, if it has been done, that all the evolution of the signs and symptoms and all the different treatments given should be recorded on databases to evaluate that with a scientific approach, and to follow a cohort of patients, because they say, Perronne, he's saying he cures people, but it's not true, it's just a guru effect, or I don't know why. I published already that I cured 100 patients, but they say, oh, it's an open study, it's not good. If thousands of physicians publish their data with good registering of clinical data in the time, what treatment did they receive, what is the result, how many are cured, it would be a major point. And after that, it will be convincing funding bodies to give money to make a good randomized study to confirm all that. But all the randomized studies against placebo were very badly defined. They are all short. Maximum was 3 months. It's too short, 3 months. 3 months, it's good for some patients, but not enough for others. At 3 months, if I was doing the evaluation they did in New England Journal of Medicine, my results would be very bad, because at 3 months, 20% of my patients are very happy. They say, oh, thank you, you saved me. But 20% are very upset, saying I'm much worse than before the treatment. And they want to attack me. And most of them, they have some signs and symptoms which are going better. Some are still worse. But if you wait 1 or 2 months more, you can see that these people are much better, and they are going toward recovery. But they stop the studies much more too early. So it's impossible to conclude, but they conclude, no, now it's done. We had done the randomized studies, it's finished. So that's not honest on a scientific point of view.
So your advice then to the doctors in the trenches and patients and family who are facing this very long-standing denial, what would you say to them? Where's the hope in the future? I know you say science.
Yeah, but I know that in Australia it's very difficult to find an open-minded physician who could give a prolonged treatment. And if it's not possible, some can go abroad, but it may be very expensive and the treatment are not reimbursed in many cases. Otherwise, you can use also phytotherapy, because now I use it more and more. It's very effective. I don't use it at the acute phase of the disease, but mainly for maintenance phase. And thanks to that, I see less and less relapses.
Is this, did you say ozone?
Many plants have a strong anti-infectious effect. So they are not toxic at all. They are very current herbs that we can use in the kitchen also, but at a good dosage. It really works. It saved many people in many countries who didn't have access to pharmaceutical drugs. I don't say that it's ideal, but it's it can be a possibility waiting for better times.
So it's herbs. And what's your comments on the human rights of people to have Lyme disease included as part of their differential, and to have doctors actually looking at the science as opposed to sort of the repetition of non-scientific dogma?
I think that the denial of chronic Lyme disease, it's a strong violation of human rights. And I co-signed with General Lucia Thayer 2 reports that we give to special rapporteurs in the United Nations, because it's not normal that in the whole world, in the whole continents, Lyme disease patients or patients with other kinds of Borrelia, relapsing fever cases and other co-infections are not recognized, have no access to good diagnostic tests, have no access to treatment. They are rejected, sent to psychiatry, and they are completely, for the severe cases, they are handicapped, they cannot work anymore. Sometimes they lose their husband or their wife, and they lose their job. A lot of them commit suicide. It's difficult to have accurate numbers, because when you commit suicide, it's never due to Lyme, it's due to depression. But through the associations of patients everywhere, we know that we have thousands and thousands of suicides due to Lyme disease, because it's impossible for patients suffering so much for years and years to hear every day, it's in your mind, you're not ill, you invent your pain, and so on. So it's a true violation of human rights.
And so for someone watching this today that might be feeling some of those things, what would you say to them?
I think now that the governments cannot stay like that without acting. It's not normal, because I think all these people, politicians, have access to the data. Of course, the politician is not able to read a scientific paper, but they should not only rely on the same people, but it's very difficult, because all the organized institutions in all the countries are following the IDSA. So I think the only way to change things now is to rely on the media, because the media represent populations. They can present in the journals, on the TV, cases of people who were ill for 20 years and who now recovered from paralysis and so on. And this has a major impact on people, and it may have an impact on politicians. I see in France, for example, at the current time, the Minister of Health is going back, but more and more deputy senators are now in my favor, and they wanted to pass laws. Recently, a law which was asked by a group of deputies, were rejected by the government. It was voted at the Senate. But when the two chambers are in opposition, they should have a common working group to say we agree or don't agree, but it was rejected recently after the pressure of the French government. But I can tell you today that many deputies, senators are very upset by that. They see every day people in their town, in their circumscription, who are suffering every day. The deputies or senators are like physicians. They see people coming to complain. Yeah. And I think that this political support will be rising in the future.
So there, I think that you're right, Professor Perronne, that there is hope, and that, you know, not only people like yourself and Dr. Horowitz are speaking up, but politicians are. And I think it's, you know, it's time for people to listen to the science.
Yes.
When we connected before we started, you told me that you have a soft spot for Australia. What's in your heart to leave people? What would you like to say from your heart to leave people with today that are watching?
I love Australia because my parents lived there during 2 decades, and my brothers and sisters were born in Australia. I was a younger of the family born in France, but I suffer a lot because I see that all the Australian patients suffer, that the physicians are attacked. The government says there is no Lyme disease in Australia, but it's not evidence-based. I say you should fight, join in associations, and fight with good arguments, providing medical evidence. Well, if we succeeded a little bit in France, because I created the French Federation against tick-borne diseases. It's a combination of associations of patients who accepted to join, and also a scientific council with physicians, researchers, some professors. So we could have a unique message based on evidence.
Fantastic. So, Professor Perronne. Oh, bit of feedback there. Thank you very much.
Thank you
I
very
really
much.
appreciate your time and your expertise. We might be calling on you for some of your support.
Okay, thank you. Bye-bye.
Bye-bye.